Wednesday, and that means it's time to be joined by our resident GP, Dr. Vicky Skitter, and talk medical. Hello, Doctor.
Hello, how are you?
I'm very well. Are you looking as radiant as ever?
Thank you.
Yeah. And we are going to be joined by Dr. Yvonne Hoy, who is a general dental practitioner, talking about the importance of oral health. Dr. Hoy, thank you very much for taking time out to join us on Mansfield today. Nice to have you on the show.
Pleasure.
I'm going to start off with a story, a true life story.
Okay.
I was, quite a few years ago, I was driving my car, I was reversing out the driveway, and suddenly I lost all control of the car and I drove straight into my gate. I slammed it into gear once again, and I drove straight into my garage door.
Oh dear.
I was totally out of it.
Did you put your teeth back in?
No, I didn't have any teeth knocked out, but I was taken to hospital, and they couldn't work out what was wrong with me. And eventually they found out I had a blood infection, which had started a growth on the inside of my spine. So I'd have a spine op to cut the growth out, a back op to cut the growth out. And they still couldn't find out what was wrong. And I was in hospital for nearly 2 months. They still couldn't find out what was wrong, but they knew it was some sort of blood infection. Eventually, they found that it was an infection that came from the back of one of my teeth. There was obviously something, there was a growth or something there, and that was constantly dripping into my system. And it caused all these problems.
Wow.
One bloody tooth. And if I'd known, I would have just blixened myself and taken it out. But it does show, Dr. Hoy, just the importance of dental, of oral health care, doesn't it?
Absolutely, and that's what I wanted to talk about today, was it's the gateway to your general health. Your mouth, anything you put into the body, goes via your mouth, and then you really need to look after and actually knock any infections in the mouth on the head very quickly, because it is the one place in the body where bacteria get into the bloodstream so quickly.
See, so we mustn't think, Yvonne, that dentists just fix broken teeth, hey? There are lots of other things you guys do, and I think it's important for people to hear, like, what kind of other illnesses or diseases could you diagnose and treat by looking into the mouth?
Well, definitely diagnosing is a big part. Maybe not the treating, but we need to know who to refer to. We would treat the perioral tissues, which are all the tissues surrounding the mouth, including the temporomandibular joint, which is your jaw joint, salivary gland disorders. We need to be able to diagnose, pick up sinus and ENT related issues, and sleep apnea, snoring, is another thing that we do treat. We can be the first to pick up systemic disease such as diabetes, HIV, and bulimia. Bulimics are often not picked up. If the parents don't know, but the dentist, when they look at your teeth, you can pick up bulimia very quickly. The acids from the stomach destroy the enamel on teeth.
That's amazing.
As I said before, the oral cavity is the gateway for your overall general health. And the last thing, screening for oral cancers. Very important. Your dentist is trained specifically to look for at all the tissues in the mouth to screen for oral cancers.
You see, you never think of, as a layperson, I never think of a dentist, a dental practitioner, as being somebody who could pick up all sorts of other
I know.
diseases or aspects of ill health.
Yeah, we sometimes think they drill and they fill. In the meantime, it's a whole
We do a lot of drilling and filling, but there's a lot else that goes on as well.
So tell me, Yvonne, so if we brush our teeth and we floss nicely, we can present you with a nice smile, hopefully. But it's also, oral health has also got lots to do with your general health. So how do they link heart disease and diabetes and adverse pregnancy outcomes with bad oral hygiene?
Yeah. Heart disease, big one. Cardiologists now know the correlation between gum disease and heart disease. Your gums, and Jeremy has alluded to how bacteria from the mouth can get into the bloodstream. Bleeding gums, even if they don't hurt, are not healthy. They are not. The number of people that just say, oh, well, my gums bleed, but it doesn't hurt. They bleed because bacteria is trapped, probably because of a buildup of plaque and tartar around the teeth. Those swollen, bleeding gums, which are inflamed, they are a toxic reservoir of disease-causing bacteria. And when you brush your teeth, or even just when you eat, you're traumatizing those gums, and bacteria get pushed into the bloodstream all the time. So the bacteria may lodge anywhere in the body, but on heart valves, coronary arteries, prosthetic hips and knees, or the very unusual case that Jeremy told us about in his spine. So it's really important to have your teeth cleaned every 6 months. Even if you don't have the checkup, you can see the hygienist every 6 months, but have your dental checkup with your dentist at least once a year to screen for all these other diseases. You asked me about pregnancy outcomes, adverse pregnancy outcomes as well. And periodontal disease, gum disease, is linked to low birth weight babies and premature births. Obviously not every time, but there's a higher risk of this. And diabetics are much more vulnerable to gum disease. Diabetes debilitates all the tissues of the body, particularly uncontrolled diabetes. And that's how we can pick it up, be the first people to see that there may be a diabetic problem.
You know, Jeremy, and Yvonne, I was at a functional medicine seminar once, and the doctor was talking about a study that they've done where if you floss your teeth twice a day, you can reduce your overall mortality by 20%.
Yes.
It makes sense, hey? I'm sure that's true.
You can, yes, it is true. Flossing, cleaning, just keep your mouth clean. It's actually not the number of times that you do this in a day. It's whether you do it well or not. You can brush your teeth 6 times a day, but you can just flick the toothbrush around. You need to know how to do it thoroughly and properly.
Would you recommend the use of mouthwashes as well?
You know, mouthwash is nice to do, but it's what you do physically, mechanically, with the toothbrush that is 98% of the job. Right. A mouthwash, don't fall into the trap that it's going to clean your teeth. It may kill some bacteria, but you have to physically and mechanically remove the plaque and tartar from the teeth. So a mouthwash on top of that is nice to do, but you mustn't fall into the trap of thinking that's something that will work instead of you brushing your teeth.
Right, Dr. Vicky, last question.
Okay.
I'm putting you on time limits.
Okay. What about babies, Yvonne? I mean, do newborns need any oral health care? And if your baby's got one tooth, do you brush like one tooth?
Yes, babies can be born with teeth. They don't usually get their first teeth until 6 months. But if there's a tooth, plaque can accumulate. Now, the important thing is to actually start working in your baby's mouth. The earlier, the better. Don't leave it until that child is going to go, You will not get into my mouth. I will not open. You see, do yourself a favor. Take a piece of cotton gauze. Just put your finger in the mouth and rub that little tooth. The baby will get used to putting something in the mouth. And the sooner you do that, the better, because then the child will allow you to clean their teeth. You can buy special little kits for babies. They're a bit like teething things, like a little toothbrush that is rubbery, maybe with some spikes on it, and the baby can chew on this, and that just helps. But cleaning children's teeth, children do not have the dexterity really to do it properly until they're about 10 years old. Let them clean their teeth, but you must actually go over it as well. So you do yourself a favor and you start putting your finger in that or something in that baby's mouth early on.
Right. Start them young.
Yep.
Yeah. Dr. Hoy, thank you very much for taking time out to join us. It's been a fascinating conversation.
Absolute pleasure.
Thank you.
Thank you.
Bye-bye. And Dr. Vicky?
Yes.
Okay.
Gaan borsel jou tande.
Nice to see you again. We'll catch you again next week. That concludes the medical show for this Wednesday. Tomorrow, we'll be talking travel and a fascinating journey across an area that hardly any South Africans have been to. We'll find out more about that with the 3 people who did that journey tomorrow in our travel show right here on Mansfield Today. Until then, bye-bye.